If you've got an athlete that was hit on a Friday and they're able to play the next Friday, that is a dangerous joke, and that doctor does not know what they're doing. I'm Dr. Mark. I'm a concussion specialist. On this channel, we talk about concussion rehab, post-concussion rehab, and how to get back to your work, school, sport, or just your regular life faster, better, stronger. Today, we're going to talk about why the 7-day return to play is dangerous. It's silly. It does, in a good kind of turn of events, it does seem that we're seeing less of this in more recent years professionally. So in the NFL, the NHL, we're seeing less of that 7-day return. I think the last time I saw it was when Tua Tagovailoa got hit. He had a concussion and then 4 days later had a second concussion. And I think that was a big professional wake-up call for kind of society and the pro sports organizations to be like, oh, maybe we should actually take the research seriously. But let's talk about why the 7-day return to play is actually a recipe for problems, for potentially second impact syndrome, which is controversially rare but a fatal condition of swelling of the brain due to repeated impacts. And the 7-day window is kind of a good spot for that to happen. So why is that 7-day window a bad idea, even though players might be feeling good at day 7? Let's break down brain metabolism and symptom timelines in concussion. So when we go to day 0 of concussion, the day concussion happens, we can assume your brain is firing on all cylinders and you've got 100% energy. That 100% energy starts to dip after the concussion. And so there's a graph that I'll show patients, and it's like if at day 0 you're at 100% energy, what we'll see is after the concussion, your brain stretches, shears, excitotoxicity. I've talked about that in other videos. But your brain has to clean that mess up, and there's an energy deficit, there's a blood flow deficit, and your brain energy levels dip about 20% by day 3 to 5. And that's also when your symptoms feel their worst, is day 3 to 5. So if you got hit on a Friday, you feel gross on Saturday, you're feeling a little more tired on Sunday, you're feeling really bad by Monday or Tuesday. But what we'll also see is that after day 3 to 5, the energy starts to go back up. It doesn't normalize until about 3 weeks, which is why a 7-day return to play is silly. But what you'll see is energy starts to pick back up around day 5 or 10, and that's also when a lot of young athletes will start to feel better. And so you've got these athletes who are hit on Friday, feel terrible Monday or Tuesday, kind of going through that, 6-stage return to play, one day at a time. They're feeling a little bit better, and then sitting on the doctor's table at rest, they go, I don't have any symptoms, I feel okay. And the doctor goes, great, you're good to play. And that's because they're in that 5 to 10 day window. The brain's starting to put some more energy out there. Their brain goes, this feels better than when I was in a deficit. You have fewer symptoms. You think you're clear to play. Super, super silly. Why is that really silly? Because we know from animal data that if you repeat a mild traumatic brain injury in that kind of vulnerable metabolic window, you can create a metabolic deficit that matches a severe traumatic brain injury. Now, for context, a mild traumatic brain injury is interchangeably called a concussion. A concussion is something that you risk symptoms in the next year, in the next 2 years, in the next, several months to several years. A severe TBI, you risk death in the next year. It's very different. And so we don't want repeat injuries in a short time period. And 7 days is kind of that sweet spot where we go, the risk is pretty high. One of the exciting things we saw is with kind of more and more research pouring out, more consensus data sort of coming together. In Australia, there's actually a minimum 21 days before an athlete's allowed to return to play. And that is very in line with the research we see with metabolic recovery of concussion. Across approximately, I think it's more than 80% of sports concussion studies, the median return to play time is 20 days. And again, that's in line with the metabolic recovery. 7 days recommended by your doctor. If you have a doctor who lets your child, this is speaking to parents and coaches, if you've got an athlete that was hit on a Friday and they're able to play the next Friday, that is a dangerous joke, and that doctor does not know what they're doing. Just calling it like I see it. And so that's why a 7-day return to play is dangerous. We've got an energy deficit that peaks at day 3 to 5, and even though you start feeling better at day 5 to 10, you're still in a significant deficit. Your brain energy metabolism doesn't normalize until about 21 to 30 days after a concussion, and that is right in line with where we see in the research that we want athletes returning to play. If you compare it to an ankle sprain, a concussion recovers as fast as, if not faster than, an ankle sprain. Please treat your brain as well as you treat your ankle. I'm Dr. Mark. If you enjoyed this video, you might also enjoy these. Thanks for watching.